but for right now, I would like to bring up on stage three people who are going to discuss social media's impact on healthcare reform. And it's not a small impact. It's through this social media that we were able to pull together this entire event in 14 days. I'm like stunned, and I know I've had so much help. I can't take the credit. But I'd like to introduce you to Mark Lopatin, a very dear friend of mine from my own district, PA 8, who is a rheumatologist and practices in Doylestown and Abington. And I'd like to introduce you Sam Brown Parks, who is a family medicine doctor from Georgia. She actually runs a brewery as well. Am I allowed to say that on film? Yeah, which I find tremendously interesting. I think there's great potential for a fundraiser, not that I'm pushing you. I already agreed that I would be given one at my home. So Dr. Parks served for a long time as a teaching attending at Emory University. And then lastly, we're going to hear another chime in from my sister friend, Dr. Zingman, and they're all going to be speaking about social media's impact on healthcare reform.
Good morning. I'm a rheumatologist in private practice outside Philadelphia. I do not have a degree in healthcare policy or economics. What I do have is a good understanding of what practicing physicians are facing every day as we try to take care of patients. And I can tell you assuredly, physicians are angry. We are angry with the lack of transparency and accountability inherent in healthcare today. We are angry that self-appointed enforcers like the American Board of Internal Medicine have deceived others into believing that a recertification exam is a good measure of a physician's qualifications to practice, and that our insurance contracts, our licensure, and our hospital privileges depend on this deception. We are angry about having to deal with cookie-cutter, one-size-fits-all approaches to patient care, and that insurance guidelines have become insurance mandates on how we practice. We are angry that we are no longer MDs and DOs, but instead we are DEOs, data entry operators. That's my new degree, DEO. And that we must document, and document some more, not for the sake of patient care, but instead to satisfy some bureaucratic entity. We are angry with ICD-10, EHR, MACRA, and MIPS, and the hoops we must jump through to comply with issues that we are not invested in. Yes, we are angry, and we are upset, and we are burnt out. Burnout rates amongst physicians have never been higher, with many physicians expressing dissatisfaction with the medical profession. Burnout results in decreased patient satisfaction and decreased patient outcomes. A Mayo Clinic study in 2014 cited that 54% of physicians experience at least one symptom of burnout. This is twice as high as the general population. 39% of physicians screen positive for depression. Suicidal ideation has increased from 4% in 2011 to 7.2% in 2014. Think of that. 1 in 14 physicians has contemplated suicide. And it's generally accepted that 400 doctors and medical students commit suicide every year. That's too much. So what does all this have to do with social media? Well, physician anger and burnout are leading to a storm of social media activity. Social media provides an outlet for physicians to express their feelings, share their frustration, and discuss ideas for improvement. It also allows for physicians to organize and advocate for reform. Social media sites such as Kevin MD and Sermo and others enable physicians to easily communicate with many other physicians from across the country and the world. Topics can range from a physician seeking help on diagnosis and management for a difficult patient to a recent survey which asked, does the AMA truly represent American physicians? Rest assured, there were a lot of responses on that topic. Communications on sites such as these help to educate physicians and shape physician opinion on issues like MACRA, MIPS, electronic records, etc. One important site I specifically want to talk about is Physicians Working Together, PWT. PWT is a grassroots physician advocacy group founded in 2015 by Kim Jackson, a family practice doc in Columbus, Georgia. Many of the leaders here today are members of PWT. Their mission statement reads as follows: "We are a grassroots group addressing issues pertinent to healthcare. We have a simple goal of preserving a quality medical system for America's future based on the patient-physician relationship." Based on the patient-physician relationship. PWT seeks to empower physicians and educate communities, leaders, and legislators, and the media on the challenges facing the American medical profession and their impact on patient care. PWT also advocates for the physical and mental well-being of physicians in order to facilitate excellent patient care in the communities they serve. Let me give you two examples of things that PWT is working on. Healthcare town halls originated in Philadelphia. These are meetings run by physicians designed to educate patients on how healthcare policy affects the actual care that they receive. Many patients are completely unaware that the decisions made regarding their health care with regard to what tests get ordered, what meds they receive, are dictated by someone other than their physician. They need to know this, and we seek to educate them. Through PWT, the idea of healthcare town halls has been publicized throughout the country, with actual events taking place in 7 states, and hope that this will expand in the future. PWT has also been instrumental in creating National Physicians Week. This is designed to celebrate physicians and to let the public know that we truly care about our patients. It honors the sacrifices that physicians make in the name of patient care. Last year, this was an informal event, but through PWT, this year, the event is officially recognized on the National Day calendar. So these are examples of the power of social media. As Marion alluded to, the organization you see before you today, PPA, is a direct result of social media and the ease with which information can be transmitted very quickly. This meeting has literally gone viral in just 2 weeks, with multiple physician groups joining together as one. Why is this important to you as lawmakers? First, social media can enable you to have a window into what's really going on in medicine. You can communicate with practicing physicians and hear what we deal with every day, and more importantly, how it affects patient care. More importantly, social media can serve as an amplifier of any message. One post on PWT can reach thousands of physicians and, by extension, their patients. One of the challenges faced in healthcare reform is educating the public about a proposal. Physician-based organizations such as PPA can help in this regard. If a proposal has merit, physicians can promote and spread this message. Likewise, if a proposal is poor, that message can also be amplified. The bottom line is that practicing physicians want to see a healthcare system that is focused on the patient, with the patient-physician relationship at the center of it. We absolutely need to cut costs, but we cannot sacrifice individual patient care in the process. Social media is a tool by which legislators can spread the message of a well-designed plan to the people who matter most in this equation, and that's the patients. Let us help you in that regard. Thank you.
So this may be just a reiteration, but I don't think we can drive the point home anymore, that social media is more than a marketing tool. In the past decade, it's become a living entity, an artificial life form, if you will. There's no question that it's filled with data, with intelligence, and sometimes secrets. Its reach is remarkable. In June of 2015, Katy Perry had 71 million Twitter followers. That's 10 million more than Barack Obama, and more than one for every person in the United Kingdom. That's power. Getting to people is power. And it's the reason we're all sitting in this room today. Had it not been for social media, I wouldn't know anyone in here. I'm just a family medicine doctor from Georgia who owns a brewery. What do I know about writing laws? And as an academic family medicine doctor, my reach was at most 150 med students sitting in a lecture hall and maybe 30 patients in a clinic. But about a year ago, I started a national conservative physician women's group. And now every day, I have thousands of interactions talking to people just like me who are just as concerned. We talk about health policy, we talk about patient needs, we talk about our personal feelings and what it's like to be a practicing woman physician in the United States, which is a challenge. For every minute of the day, every single minute, 24 hours of video is uploaded to YouTube. There's a vast sea of untapped, inexpensive resources just waiting for us to use them. We can use this to connect, we can use it to educate, we can use it to change laws, and we can actually use it to treat patients. Much like a good lumbar puncture, we need to tap purposefully and precisely in just the right spot to get what we need. To our legislators, you're faced with developing a new plan or revising an old plan for our nation's healthcare system. I implore you to explore these resources that are right at your fingertips. As a physician, I would appreciate having my input on this topic and many others because it affects my life, it affects my livelihood, and it affects my patients. As a conservative taxpayer, I would also appreciate the use of as many cost-saving measures as possible. I don't envy the position that lawmakers are in, but as I learned while studying health policy, you have to consider all stakeholders when you're trying to come up with a successful solution. And physicians are large stakeholders in this. We are the vital tool to making America healthy. We come to this meeting from both sides of the aisle, and the general public may be on opposite sides of a very great divide. But as physicians, we're a few steps apart from a common goal. And that common goal is to help preserve our patients' health, but I wouldn't say more importantly, but vital to us is preserve our profession. I encourage you to use fiscally responsible methods, such as social media, to get at least some of us to the table so that we can experience this all together and succeed. Thank you.